June 2nd, we wound up in a hospital in Miramar. We had gone to the emergency room twice before that, at that point. And my wife was not feeling well. We knew that she was pregnant up until that point, but we didn't know it was triplets. Or did we? Did we know at that point it was triplets?
Yeah, we did know that.
Okay, so we just had found out within a week or so that it was triplets. And when they told us the news, we were kind of like, triplets? Like, that was kind of like overwhelming, but happy at the same time. But progressively, as days went on, my wife was having a hard time, like, breathing, and certain signs started happening that I didn't catch. It started out like on right before June 2nd, that she was having some numbness on her lips. And then from there, it started gradually where she said she had a little shortness of breath. And then every day, there was a little key, something else coming on. And it got to the point where progressively, after like a week or two, leading up to June 2nd, that she had told me, I just can't breathe, Anthony. I'm having a hard time laying down. So it went from laying down full right to slightly elevated with a pillow to 2 pillows to 3 pillows, to the point where she was not even in her bed at all anymore. And I'm bringing chairs from my living room that she could kind of lay in bed, like make a bed, makeshift bed, next to the bed. And then I started realizing this is probably not normal. Something's really becoming a problem here. We went to multiple doctors, and nobody could figure out what was wrong with her. They all said that, it was probably attributed to the triplet pregnancy. I went to her, it was a Friday right before June 2nd, probably that weekend before. And I took her to an acupuncturist, because we believe in acupuncture. And our acupuncturist said this is something very severe, that you need to bring her to doctors. So that day I brought her to 3 more doctors. I brought her to the asthma specialist, because they were thinking something was wrong with her breathing for asthma. And then from there I brought her to a chiropractor, because I said maybe something's not aligned, because all the conventional doctors couldn't figure it out. And by that night, I realized that this is serious, because when she took her breathing test, she scored 30%. And the lady said, this is not possible. They had to do the test like 10 times, to the point where she was turning red, because she couldn't breathe. Her stomach was like going in and out on its own. And I was looking at it saying, that's not normal, but everybody's saying because it's triplets. So at that point, that was a Friday night. I think on Saturday, I wound up in the afternoon bringing her to the emergency room. And that was at a hospital in Miramar. And basically, the doctor there, for the second time now, this is the second time I went to the ER, the doctor there, a different ER doctor, said, no, there's clearly something wrong, but I don't know what it is. He said, based on x-rays from the previous delivery that she had had, it showed that her lung was elevated and her diaphragm was elevated on one side. So they knew something was serious, but they didn't know what. So from there, they said, we have to admit her, and I said, please do, because this is not something that you want to play with. And at this point, she had shortness of breath. She was kind of gasping for air, and she was, her stomach was going in and out, and there was still no answers. And I checked the internet, I read everywhere, but there was nothing that made sense, other than, pointing back to triplets, because everybody said, it's probably the triplets causing that. And so from then on, it was history. We started on June 2nd or 3rd, it was a Saturday, I think, and they moved her straight into intensive care. And from there, they were treating her with breathing treatments, like as if she had asthma, and no definitive answer what was really wrong. They did testing, but they couldn't come up with the problem. So I was very persistent that we need to get to the bottom of it, because I knew my wife was in trouble. She had a natural delivery with my son prior, no meds at all, and didn't complain. And I knew that if she couldn't breathe and she was complaining, that this is serious, So there was a point where, one of the workers, the nurse social workers at the hospital came in and asked me if my wife had any mental conditions or anything that would cause this to be where she's fabricating something. And I looked at it, I said, no, if anything, you're looking at the nut. I'm the nut, not her, So From then on, I talked to all the doctors one-on-one, and I stood at the hospital 24/7, as these doctors know. I slept 7 weeks near her to make sure that nothing got through the cracks. And I believe that, what worked out at the end was that, how we wound up here is one of the doctors, out of the 5 doctors that were treating her, one of the doctors said, I think that she has something called Myasthenia Gravis. I said, what's that? I never heard that name. And he said, no, don't jump to conclusions, relax. He said, let me get a neurologist involved. The neurologist needs to oversee, look at her and determine he's the one that could diagnose it. He was an intensivist, the doctor that I'm talking about. And sure enough, at the end of the neurologist comes in, and he wasn't taking it serious. He said that there was nothing wrong with my wife, in quotes, and I'll quote it. You should go home and eat cereal and watch TV. There's nothing wrong with you. You're going to get sick here in the intensive care. As her stomach is going in and out. And I said to my wife, I said, if this is what it is, in my mind, I'm thinking like my wife is going to die, because they're not doing anything for her, essentially, to other than breathing treatments. They're doing testings that take a long time to get results, and not getting to the bottom line. And the bottom line is my wife can't breathe, and nothing's being done. So from there, progressively, during the 10 or 12 days that she was in intensive care at that hospital, it got worse and worse and worse and worse. And I started telling everybody, clearly, and I have no problem saying it, that if my wife dies here and nothing's being done, that you're all coming down. I'm going to take you all down. I'm going to have lawyers involved, and you're going to have a problem with me. So of course the director of the hospital got involved, and it became where they put a little more attention into it. But it still wasn't enough. So the doctor who told me, hey, I see something's wrong with her, but it's up to the other departments to decide what they need to do, because it's not I'm the intensivist. You need to basically go from this point. They take over. So the neurologist comes in, looks at her, and says, "There's nothing wrong." I don't know why they're wasting my time, in quotes, with this, because obviously it's not a neurological issue. And I've seen myasthenia gravis many times in my practice, and this has none of the signs. And I said, well, doc, with all due respect, I did a lot of research now on this myasthenia gravis, and I respect you as a doctor, but I think you're making a mistake. And he said, well, you're not supposed to know. You're not a doctor. You're not supposed to know, and I understand. I respect the fact that you're questioning it. So I said, well, if it's not that, then what is it? He said, it's nothing. It's probably related to the pregnancy. So he left. And I couldn't take that no for an answer, because I knew that it was serious. So at that point, the next day, I see him sitting at the desk, and I'm watching my wife, and all of a sudden I'm talking to her, and her eye starts kind of going down a little, sagging. And I started thinking she was having a stroke, because I'm not a doctor. So I said, this is serious. And he now, the next day, is at the desk. I'm telling all the nurses, look at her eye. It wasn't like that yesterday. The next day, he's at the desk. I tell him, there's something wrong with my wife. Her eye's now drooping. Can you please come look at her? I don't even remember if he did or didn't get up off the desk. I think he didn't, because he wasn't taking it that serious. And then after a couple of days, past that, he started to see it. The director at this point's involved, and it just so happened that they called in a specialist, like an old perinatologist, because everybody's attributing it to the pregnancy. And that perinatologist we happened to know because we saw her with my son, my first son's pregnancy. And she walked in and said, I know you, to her. She's like, and why is your eye looking like that? Right off the bat. Why is your eye, it wasn't like that a year and a half ago when you were in my office. And I said, thank you, God, thank you. Finally somebody is saying, seeing it. I said, Doc, you remember that her eye didn't look like that? She said, clearly, there's something wrong. So from there on, it kind of gave me the push that I'm not losing my mind. The 4 of the 5 doctors saying nothing's wrong with her. Next day or whatever, at the end, towards the end of her stay there, and during the process, they wanted discharge, by the way. Discharge. So I said, no, you're not discharging my wife, until this is fixed. So family was telling me, I think you need to get her out of there. And I said, where am I bringing her? Try to get her transferred to Jackson. Because she had no diagnosis, they would not accept her. Because they would not give her a diagnosis. I tried to get her to another Memorial Hospital on 2 different occasions. I'm talking 24 hours waiting. I tried to get a transfer to another hospital. They would not take the transfer because there was no diagnosis and no receiving doctor, and nobody wanted the liability of triplets. That's what it came down to. And it was told to me by some of the doctors, nobody wants to not doctors, the nurses, nobody wants to really touch her because she has triplets. And if anything goes wrong with the pregnancy, they're on the line. So I said, okay, we're going to let my wife die now. We're going to let her die with all 3 babies in her stomach and herself. Because at this point, the pregnancy was the least of my worries. As these doctors know, I had drilled them about whether we were in trouble with this pregnancy or not. Because at this point, it was about saving my wife. If I save my wife, the babies will be okay. And so, it was a process, and it was obviously a lot of talks with the family and stuff like that. But ultimately, the night that was the icing on the cake is that they agreed to do a transfer to another Memorial Hospital, which basically we wanted, because we wanted a whole another group of doctors. And then a doctor there, actually a nurse there, I'm sorry, said to me, Anthony, let's think about this. If you have a group of doctors that work at one hospital and the same group is working at the other hospital, what's going to change? And I looked at her and I said, and I was frazzled because at this point I thought I had it all figured out. We're going to move her to another hospital, we're going to get diagnosed, things are going to get fixed, and we're going to be better. And it just didn't work out that way. So at that point I said, I think she's right. I called all the family on the phone. This is what we've got. What do you guys think? Because at this point I was not even thinking clearly because I didn't know what was right or wrong. And they all said, get her out of there. So I called the doctor who has been the one from day one that said he thought it was Myasthenia Gravis. And he told me, listen, he said, my hands are tied, you got to do what you got to do. If you do want to you leave, I cannot discharge you, but you have the right to walk out. And that's exactly what I did. I asked for the records, and we walked out. I wanted to take her out on I think it was a Saturday night at 10 o'clock, because they had promised me the transfer that never happened. So I said, honey, we have to leave. And my wife said, I just can't do it. I can't do it. I just have no energy. I can't breathe. I can't do it. And I said, you have to do it. This is not an option. I mean, if you don't do this, you're not going to make it. So she said, give me till the morning. And by the morning, she got herself dressed, and we drove straight to Jackson. That was the day of the Miami Heat's game, somewhere in June. And it was on a Sunday. At 2 p.m. we left, walked out of the hospital, put her in my car, drove her straight here with her brother, came in the ER, and I said, on the way here, if they can't figure it out, I don't know what we're going to do, but we're going to head to another state to get another hospital. I was thinking New York. And within 45 minutes, we were lucky. There was only 2 people in the ER. And they took her in. They saw how serious it was. They saw her stomach moving. They knew clearly. They took the records. I started telling what happened at the other hospital. And the nurse there says, I prefer you not tell us what happened. I remember it clearly. I prefer you not tell us. Give me the records and let us do our job. And I said, wow, okay, no problem. And that's what took off. It was 2 o'clock on Sunday. They did every test you can imagine by 8 o'clock the next morning. Within the first 45 minutes, they had neurology teams down there. I remember there was an ER doctor. She was incredible, and she made us feel very comfortable. My wife's arms were all bruised up, top to bottom, because at this point she had been poked and prodded for 12 days. And I said to the nurse, listen, she was trying to get my wife's blood. Please, ask the doctor to do it, because my wife is torn up. And so this doctor came in nicely, pulled it in one shot, and walked out and said, we're going to handle everything, don't worry. And she was the one that started this whole ball on, and chain moving. Basically, it was like incredible from that point on. And I'll never forget that.
At what point was she diagnosed?
it was 2 o'clock on Sunday we got here. At 8 o'clock, we were put into a room the next morning, and at 9 o'clock, Dr. Shebert came in with his team of doctors, and it just so happens that on rotation was him, and supposedly he specializes in myasthenia gravis, and he knew clearly, looking at her right off the bat, he said, this is myasthenia gravis and this is MuSK. This is the MuSK antibody, and he's talking to his group of doctors, and I'm looking at it like, MuSK, I'm writing it down, what is MuSK? And I'm thinking, and he says, we have to treat this, we cannot wait. For blood work, we cannot play around, this is serious, and he was throwing orders, and he basically just left. He said, I'll be back, thank you, and he left. And immediately, the ball started rolling.
There was a lot of relief on your behalf, on your wife's behalf at that point.
Relief, you said? At that point, I said, thank you, God, thank you. I found doctors that actually know what they're doing, and that these people here, this, by the way, is the dream team, these people saved my wife's life and the 3 babies. From that point on, it was like I could back up and let them do their job, and I was asking a lot of questions.
He doesn't back up easy.
How many months
If
was
I-
she pregnant when they finally came up with the diagnosis?
8.5 weeks.
8 weeks.
8.5 weeks?
8.5 weeks. She was in the hospital from 8.5 weeks to 13 and a half
She
weeks.
stayed in the hospital after they diagnosed her and continued her pregnancy here, or?
7 weeks we were here, 5 to 7 weeks, and by the middle of July, we were out of the hospital after the first day, because I thought at this point, I said my wife was under control, and Dr. Verma said, I want her to come back on the 2nd of July. And I said, can you just let us at least enjoy the 4th of July? We've been in the hospital for, at this point, 3 or 4 weeks. And he says, that's fine. If that's what you want to do, that's fine. Well, I didn't take his advice, And she had a relapse, and her stomach, we were home for like 4.5 days, and her stomach started going like this again, bad. And we rushed back in, I told him, and he's like, I told you. I was like, I'll never doubt you again. And that was it. From that point on, she's been, under control, you asked me a question, I don't know if I answered it.
Tell us about how her treatment was, from the moment you found out what she had up until
The
she
first-
was delivered. How it was different from your first pregnancy, obviously.
Well, it was night and day. The first pregnancy, there was no issues, blew right through, delivered on the actual day naturally. This pregnancy was not an issue pregnancy-wise, even though it was triplets. She did an incredible job, really. I mean, she only gained 20 pounds, so you could just imagine, and 22 with my son, the first one. No related problems to the pregnancy, except this myasthenia that came out, which was very scary. So it was very different in the sense that, you weren't just dealing with one medical issue, you're now dealing with Andrea's life, the medical issue, and the 3 babies that complicated things for the doctors, because they probably would have done a lot of different things, more aggressive, but it was like the first 5 days that we were here, she was being treated, and I think at some point Dr. Verma stepped in as the next rotating doctor, and we just liked him. He had a good bedside manner. He was really personable. I remember in quotes, he says, Anthony, you probably remember this, your wife, Andrea, is my most precious patient. She has not 1 life, but 4 that I'm looking out for. And I said, that's the doctor that's going to help my wife. And from that point on, it had progressively gotten worse because she had been hospitalized. Nothing was being done really to stop the situation. So at that point, we were, here about 5 or 6 days in a regular room, and the Dr. Shepard, his name was, which was a resident doctor in neurology, excellent also. I asked a lot of questions. I was talking to him, and I said, what's going to happen? He said, this is Friday now. I don't like her oxygen levels. I prefer to put her in intensive care so they could watch her closely throughout the weekend, at least till Monday. And sure enough, Friday, Saturday, the numbers are getting low on her oxygen. By Saturday morning, I started noticing that she was very lethargic, but I figured she was exhausted because she hadn't slept for literally 2 months at this point, and laying down. she'd sleep with it propped up in the bed with a pillow here like this, and that's not sleep, you know? Maybe a half hour here and there, you know, with nurses and doctors coming in. So by Friday night, it got to the point where her stomach, I went downstairs, and the family was up visiting her in the intensive care. I went downstairs, and her stomach stopped moving up and down. And I said, her mom came and said, Anthony, she's doing so much better. Her stomach is not moving anymore. I come to find out there's accessory muscles in the stomach breathing for her because her respiratory is shut down. And her mom said that she's doing better. And I said, really, let me go up. I went up, and she looked so peaceful, laying there, nice and calm. Her stomach wasn't going in and out. And I said, honey, are you okay? She said, like that. Like, I figured she was sleeping. So I said, let her sleep. And I told all the respiratory therapists, I told everybody, please leave her alone. Let her sleep. She had not slept in 2 months. Well, that was Saturday. Sunday, by about 1 o'clock, they're looking at her numbers, and they're going down and down on the oxygen saturation. And now we're going to the 90s, high 80s, and they start telling me, you know, this is not really, we don't like what we're seeing. I said, well, what are you seeing? You know, she's not getting enough oxygen, and we're getting to the point we could be in trouble. I said, okay, I know what trouble means. Trouble means intubation, you know? And my wife told me clearly, whatever you do, Anthony, make sure I'm not intubated, you know? So I knew her wishes, but at the same time, I knew what the doctors were telling me, so I was really afraid.
One of the doctors talked to us about this condition,
Sure.
what it means and how rare it is.
Yeah, so I saw her next day morning.
Can you give your name again?
Yeah, this is Dr. Verma, neurology attending. So I saw her in the morning.
Hold on 1 second. Let me just-
Just spell your name right.
V as in Victor, V-E-R-M-A.
Dr. Vernon, can you tell us how rare this condition is and what it means?
Yeah, so I mean, the diagnosis was not in doubt of myasthenia, but it seemed to be a rare type of myasthenia, which is about 5% of all myasthenia. So myasthenia itself is rare, and out of all myasthenia, it is about 1 in 20. And the other thing was this was newly recognized entity. This was described about 10 years ago in UK. So not many people may be familiar about the spectrum of MuSK-positive myasthenia. But her picture was very classic, meaning the type of problem that she had, swallowing difficulty, a respiratory problem, that was very classic. So right from the beginning, there was no doubt it is MuSK-positive myasthenia, though the result came after about 7 or 10 days. The third element was MuSK-positive myasthenia usually does not respond the way other myasthenics respond. And that's what was going on. This was going downhill. They were trying medications outside, and we tried here, but we did not know where the bottom was that time. And so it progressed over the next 3-4 days, more respiratory difficulty, until the time it found a bottom, and then stayed there, and then improved. So those were the two elements in the myasthenic course with regard to MuSK-positive myasthenia. A, how to arrest the disease that time, how to maintain the arrest, and then how to pull on during pregnancy. So that's what we did. So in the beginning, she was in ICU, was stabilized, started improving, and was in good shape. And that was the time he was going home. I was bringing her back in about 7 days, and told, well, it's 4th of July, let's be there 4th of July. And I knew actually for how long this medication will work. And I think it was the third night she started having respiratory problem, and age usual in the myasthenia, particularly MuSK, is if the respiratory problem, bring her in the hospital first and think later. And I think they listened to that, and so 4th of July she spent in the hospital. We again started the treatment, and again she started turning around. And once she was in good shape, then we discharged her, and then we maintained during pregnancy with a regimen.
Her being pregnant is the first case of a pregnant woman with triplets going through that?
Yeah, that is right. I mean, there were other elements also. She had Hashimoto, thyroid problem, That also, I believe, is the first time with Hashimoto and with triplet pregnancy. I haven't heard, I haven't read, and I haven't seen. So this is the first triplet pregnancy-related, the beginning of myasthenia, yes, with MuSK positivity.
What causes it?
Pardon me? What causes that? This is a kind of autoimmune disease where body's immune system starts fighting with certain elements. And that was another element in Andrea. Because she had other autoimmune disease, the myasthenia was more likely. But MuSK positivity, I mean, that was a little kind of penny dropping because of the type of weakness.
Does it have anything to do with the triplets? Or
And,
is
you
there
know,
an explanation how she developed it?
yeah, nobody knows because this entity was first described by a team in UK in 2001, and because it is rare, because it's newly recognized, there's not a lot of literature about MuSK positive myasthenia.
Does it affect the babies in any way during pregnancy?
About 10% of babies may be affected because these antibodies, they may travel through placenta and may get in baby's system. So they may have weakness. So that was another issue. I wanted her to be under care of Dr. Yassin, who's sitting on my left side, to make sure that we are as a team together when babies are delivered, because 1 in 10 babies, they may have what we call neonatal myasthenia.
In this case, were any
They
of
did
the
not.
babies affected?
Now,
And the babies are doing fine? Are they having any health issues based on her diagnosis during the pregnancy?
no, I don't expect any problem for babies now.
Andrea, ¿qué me puedes decir? ¿Cómo te sientes después de todo esto?
Muy bien.
¿En algún momento te viste por tu vida?
¿No te oí?
¿En algún momento te viste por tu vida durante todo este proceso?
¿Que si tuviste qué?
¿Que si temiste por tu vida? ¿Were you afraid?
Oh, no. No, yo no creí que iba a morir, no.
Can I jump in there? I remember recently recently spoke about this, and I asked her, you know, I was really fearful that she was going to die, and I wanted to be there to make sure that I was there with her no matter what. And you know, she said, I knew I wasn't going to die. Everybody's coming into the room looking like I was going to die, and I wanted to throw them out. She said, because I wasn't going anywhere. I have triplets that were going to be okay. She knew this from the very beginning. My wife is the most incredible mom you can imagine. I have a 20-month-old, and she said, you know, I had to live for him and for the babies that are inside me.
Andrea, pero no tenías miedo por los bebés, como madre, ¿qué estabas sintiendo en ese momento cuando te dan el...
No, yo sabía que todo iba a estar bien.
¿Pero por qué? ¿Hay algo en tu corazón, en tu alma? ¿Por qué sentías que todo iba a estar bien?
No sé.
Está muy
No sé.
emocionada todavía, ¿no?
Sí.
Pero cuéntanos cuando, luego de tener la alegría de lograr este embarazo, no solamente un embarazo, ustedes habían tenido problemas de fertilidad, un embarazo de trillizos, y que entonces encima de eso les digan que tienen una enfermedad extraña. ¿Qué pensaste en ese momento?
No sabía, todo pasó muy rápido. Pero sabía que tenía fe y sabía que todo iba a estar bien.
¿Cuál fue el momento más difícil?
Cuando me intubaron.
¿Por qué te pasó?
No, nada, que no podía hablar ni nada.
Actually, to add to the picture for those not alluded to yet, also having the babies was another miraculous process. I know that Anthony would like to tell you, but normally triplets don't last, you know, they last around 31, 32 weeks, but it's a pregnancy that is not smooth on even a completely healthy person. The day she had the babies, it wasn't planned, just like Anthony always gets into things. She had non-specific complaints. She didn't feel right. That's all. He brought her almost immediately. He's always in control. And well enough, by the time she made it to our OB triage area, taken to the labor floor, complain of much. And within probably 15, 20 minutes of her arrival to the labor floor, she was already on her way to the operating room because one of the placentas of baby A split before its time. And her feeling of not feeling good, she was bleeding into her uterus itself. And so, luckily enough, we have a system and people who drive things fast, just like with her myasthenia management to start with, to the management of her delivery. In no time, she had no bleeding, no issues herself, but in no time, she was in the operating room. And those 3 babies were out of her belly within 1 minute. All of them have the same birth time and birth date, by the way. Same time to the minute. And what she was feeling was a very serious business, something we call it abruptio placenta, which the placenta separates before its time. And that is a life-threatening condition. And so she had it twice, and she pulled through twice. And that is the beauty of life, how it comes and where it comes to be.
Doctora, ¿usted habla español?
Sí.
¿Me puede decir? Sí, sí, el micrófono.
Yeah.
And how old are you now?
Should be 2 weeks now.
2 weeks.
November 1st, they were born.
Can I make a comment about Anthony always being in control? Because I'm the ICU attending, and I have to tell you that Andrea was in control.
Yeah, thank you. I would get the bad rap.
So in the ICU, it was very difficult to be intubated, right? But that was because you couldn't talk.
Right.
And it drove her insane to not be able to talk. But she was wide awake, and she was in bed, and she had everything to do with what was happening.
She remembers.
And every day, she would have a list of 15 questions, and they were written, and she would be writing feverishly about everything that was happening. She wanted to know everything that was happening, and couldn't we take the tube out, and couldn't we do it sooner, and didn't I think that really it was already time, and very much, and I understand that this is a lot to sort of go through, but I have to give
It's really important.
credit for that, because during that very difficult time, although, Anthony, you are a separate force to be reckoned with, Andrea was very much, the driving force behind what happened and how it went and what her wishes were and how this was going to go. And that was very important, I'm sure, for your recovery. Sí, voy a tratar lo mejor que puedo, sí.
¿Su nombre y su
Sí, yo soy Cristina Ofela y soy doctora de sala intensiva de Neurocritical Care.
¿Qué condición tan crítica se encontraba la paciente y ustedes como médicos, cuál fue el obstáculo más grande que tuvieron?
Bueno, el problema era que Andrea tenía o tiene este problema con la sistema inmunológica y que por eso no podía respirar bien. Ella entró a la sala intensiva porque ahí podemos mirar las respiraciones bien y ver si necesita ayuda con ventilador. Después de unos días de tratamiento ya no podía respirar bien y bajaron el oxígeno, el nivel de oxígeno, y por eso necesitaba un tubo para ayudarla con las respiraciones y el ventilador. Y tuvo eso para ¿cuántos días? Era como 8 días. 8 días estaba ahí en la máquina, pero estaba despierta. Y yo pienso que el problema que ella estaba diciendo era que no podía hablar y no podía comunicar las cosas que necesitaba allí en la cama con el tubo y todo.
Y ustedes
And no
como
pain medicine.
médicos, como decía el doctor, no es solo tratar un paciente, sino
Eran
4
4
pacientes a la vez. ¿Cómo enfrentaban ese reto, ella en el ventilador, embarazada, los trillizos?
Sí, bueno, la cosa primera era Andrea y el salud a Andrea, y por eso nosotros hablamos mucho de el embarazo y todo, pero era Andrea y necesitábamos que ella estaba sana primero. Y después de eso, siempre mirando los bebitos y todo, pero...
¿Qué hubiese pasado si Andrea no hubiese recibido la atención adecuada pronto?
Bueno, con respecto a la respiración, bueno, cuando el oxígeno baja puede tener problemas con daño al cerebro y todo, no queremos que nada pase así.
O sea que si ella no hubiese venido a Jackson y hubiese sido identificada su condición, ¿qué le hubiese pasado?
Sí, bueno, no podía respirar bien, uno puede desmayarse y después el oxígeno no llega al cerebro y uno puede tener daño al cerebro.
¿De qué forma hubiese afectado eso a los niños?
Y también eso puede afectar el embarazo, sí, por supuesto.
Doctora, usted ahora está a cargo de los bebitos. ¿Nos podría ofrecer por los micrófonos?
All the microphones.
Sí, nosotros... Sí. Mi nombre es Teresa del Moral y soy neonatólogo de la unidad de cuidados intensivos de aquí del Jackson. Los bebés están todavía en cuidados intensivos, afortunadamente están mucho mejor, es decir, desde que nacieron había 2 bebés que procedían de un mismo saco y un bebé que era el que tenía una placenta distinta y que fue la placenta que se desprendió y que hizo que la madre sangrara y que hizo que el doctor Yacine le hiciera una cesárea urgente. Y este bebé fue el que nació con más problemas, pues porque de ese sangramiento había aspirado un poco de sangre y entonces tenía dificultades para respirar, aparte de las dificultades que tienen estos niños por ser un poco prematuros. Entonces este fue el que necesitó ser intubado, igual que la mamá, y los primeros días estuvo un poco más grave que los otros dos. Los otros dos, uno nunca necesitó ningún cuidado respiratorio y marchó siempre para adelante, y el otro necesitó un poquito de asistencia respiratoria. Afortunadamente los 3 están bien, los 3 están comiendo, han tenido complicaciones que son inherentes a ser prematuros y solo uno está con un poquito de oxígeno, pero los otros 2 están bien.
¿Hasta cuándo se espera que los bebés van a estar
En el hospital generalmente se dice, cuando a estas preguntas las hace la madre con mucha frecuencia, se pregunta ¿cuál era su fecha probable de parto?
El 11 de enero.
El 11 de enero. Pues se espera que se vayan antes, probablemente, pero generalmente es alrededor de esa fecha. Yeah, English.
¿Qué tipo de riesgo representaba la condición de Andrea para los bebés?
O sea, el riesgo era muy importante fundamentalmente por eso, porque si la vida de la madre está en peligro, o sea, si el cuidado de la madre está en peligro, o sea, los niños van detrás de lo que le pasa a la madre. La pregunta que estaban haciendo de no poder respirar, de la falta de oxígeno, eso afecta a la madre y obviamente afecta inmediatamente a los niños. Y eso por una parte. Por otra parte, o sea, es bastante complicado, es un embarazo triple, con niños bebés que a lo mejor que pueden no crecer adecuadamente ya simplemente por ser un embarazo triple. Y además de todo esto, pues lo que ha comentado el neurólogo, que son niños hijos de una madre con Myasthenia Gravis, que muchas veces, pero hay un porcentaje poco, pero que también pueden estar afectados al nacimiento. Afortunadamente en esta ocasión no tuvieron ninguna complicación relacionada con la enfermedad de la madre.
¿Podrían los niños tener esa enfermedad y luego hay que monitorearlos el resto de su vida?
No es una enfermedad hereditaria por sí, es una enfermedad, o sea, el hecho de que la madre la haya tenido probablemente predispone un poco desde el punto de vista general, pero no es que porque la madre la tenga los niños la vayan a tener.
¿Y van a desarrollar algún tipo de complicación a raíz de esto?
Las complicaciones, si hubiera tenido una complicación por la miastenia gravis hubiera sido inmediata, o sea, ahora con el tiempo que ha pasado ya no se espera que tenga ninguna complicación por esto.
Doctora, en español, ¿se me puede explicar qué consiste esa enfermedad y lo rara que es? Porque tenemos entendido que ella ahora ha sido una paciente, la primera paciente con trillizos que desarrolló esto, ¿no?
Bueno, yo no soy la neurólogo, pero traduciendo las palabras del neurólogo, es una enfermedad rara y es una enfermedad que fundamentalmente afecta, digamos, los músculos, es decir, que la persona que se ve afectada por eso como que no puede, no tiene un buen tono muscular, no puede moverse bien, no puede... Entonces esto llega a un momento que afecta al sistema respiratorio, es decir, que la persona se siente sin fuerzas para respirar, no puede respirar bien. Y entonces eso es lo que le pasaba a ella, que al principio probablemente simplemente no se sentía bien, no se podía mover, lo que contaba Anthony, de que no podía, decir mañana nos vamos, y ella no se podía mover, y luego eso va afectando cada vez más hasta que llega el momento en que la situación respiratoria se compromete, y es por lo que tuvo que ser intubada.
Andrea, ¿a ti te gustaría decirle algo a los médicos que muchas veces quizás te salvaran la vida?
Gracias. No sé decirlo en español, pero que yo no estuviera aquí si no era con ellos, sin ellos.
¿Y cómo te sientes ahora que los bebés están en camino de una franca recuperación?
Muy contenta que todo está bien con los bebés.
I think everybody needs to know, like, I want to say this before you guys finish up. It's hard to say, to express into words how thankful you are. Because how do you say thank you for my wife's life and 3 babies times two? I mean, these people here, Dr. Yassine saved my wife and the babies because it was really critical. I mean, one of the babies was very critical, baby A. Ashton. How do you say thank you for your life? I mean, my life would be completely different if these people were not as good at what they do. Dr. Dwyer, like she took us under her wing and pretty much made sure that the babies are being taken care of top notch. Dr. Demerara is, she's incredible. I mean, I remember conversations with Dr. Phelan, in the intensive care, room, and I remember talking to her, like saying, what do you think is going to happen? And she always put herself to not a doctor level. She talked to us like she was our relative, and Dr. Burma, you don't get that. It's incredible, and everybody needs to know. I told Andrea, this may have happened to us for this reason. We had struggled to have our babies and even get pregnant, and then like to have that taken away would be almost inhumane. And these people here saved that from happening because it was very close. And I think it's Jackson, that needs the recognition. The staff here, Dr. Yassine, the neurology department. You have to see, like, we go home at night, we worry about our babies, but we're not worried that they're not being taken care of because they're incredible. And I leave with peace of mind knowing that everybody's on cue here. And the thing is, the perception outside, that's why I want everybody to know. This happened for a reason, okay? It happened so we could educate people on our fertility struggle. It happened that we can educate people on myasthenia and what the signs are. My wife said that that's why she thinks this happened to her, is so that she could be the spokesperson to tell people that this could happen to anybody. You know what I mean? We're healthy. We eat organic foods. We don't take medicines. Other than now with her, this normally shouldn't happen to somebody who, is leading a good lifestyle. And I really think that these people here just are. I want to individually thank everybody for taking the time to really help us, and the gratitude is beyond words.